In Africa, we have great respect for those who reach 60 years. Their knowledge benefits everyone in the community. As grandparents, they look after many children. But now our elderly population is under threat from the new illness, COVID-19, which is caused by coronavirus. If we wish to protect them, we must find solutions together as communities. So here is the problem we face. Coronavirus spreads very easily. It is a tiny particle, much too small to see. When someone with the virus coughs or sneezes, those close to them will also become infected. This is why everyone needs to stay a bed length apart from each other. The virus can stay on doors, taps, and other objects for several days. If you touch them and then touch your nose, eyes, and mouth, you can catch it. That is why everyone needs to wash hands frequently with soap and water for 20 seconds. If an infected person passes it on to 3 others, who then each pass it on to 3 more, in a few days a whole village can be sick. COVID-19 causes cough and fever, headaches, body aches, chest pains, and tiredness. Some people lose their sense of taste and smell. Children can catch the virus, but they usually get only 1 or 2 symptoms. As you get older, the illness becomes more dangerous. Someone who is 50 is more likely to get seriously ill than someone who is 20. Anyone over 60 is at much higher risk. They have less strength to fight the illness. It takes away their breath and some die. It is also serious for those who have other conditions like heart problems, diabetes, or high blood pressure. It is impossible to know who has the virus. Children can easily infect their grandparents who may die. So what can we do to keep the elderly safe? First, they need to sleep in a different hut or bedroom from other adults and children. Grandparents may have different preferences on how to do this. In some places, the children are moving out of huts or bedrooms that they share with grandparents. Where families have more than 1 hut or bedroom, people are moving around to allow grandparents to sleep by themselves. Each community and family needs to decide what is best for them. They may find other solutions. It would not be a good idea to put all the elderly to sleep together in one place. If one of them were to be infected, all of them would risk catching the virus. It is important that whoever cooks food cleans their hands with soap and water for at least 20 seconds before they start. And of course, everyone must wash their hands before eating. If an elderly person needs looking after, then the caregiver should also be sleeping away from everyone else. It is fine for the elderly to go outside, to talk to people, exercise, and to work in the field. But they must stay a bed's length away from everyone else. Everyone in the community needs to do this. Wearing masks can also help to stop the spread of the virus. Masks made from cloth must be washed frequently. Doing all these things may be challenging, but it will save lives. Thank you.